Hi, this is Sara Siddiqui, pediatrician at the Huntington Medical Group, and I apologize for being late. I was having a little bit of technical issues with my computer and going live. So let me know if you guys are here and listening. Let's see. Okay. I see maybe somebody here. So this is Dr. Sara Siddiqui, and I'm here to talk about vaccinations and the importance of vaccinations. So, okay. Hi, Liz. I just see that you've joined us. I apologize for being late. So one of the important topics that we like to discuss as a pediatrician is to maintain your vaccination schedule and make sure that you are bringing your children into your pediatrician. Unfortunately, because of the shutdown and the stay-at-home orders, it has been very common for people to not come to their pediatrician and even their primary care doctor for that matter. So it's really important that you continue your care with your primary physician and your children's care with your primary pediatrician. The American Academy of Pediatrics is currently doing a campaign where we're trying to advocate and encourage people to come in and see their pediatrician. So we call it #CallYourPediatrician. So today's discussion is more about vaccinations, and I did get some questions from some of the staff at the library. So I could start off with some of those questions, but please, if you have any questions, please type them in, and we can get started. I'm sorry again that we started off a little bit late, and I hope that this is helpful for you. If there are any topics that you are interested in a pediatrician doing through the Elwood Public Library, please reach out to them and let them know, and we'll try to cover that as well. But thank you for being here, and thank you for listening, and thank you to the Elwood Public Library for giving pediatricians this kind of forum to discuss important topics with the community. So why are pediatricians so concerned that the CDC reported recently that there was a 63% drop in ordering of vaccinations in pediatric offices? So this is very concerning for us to hear, because that means that we aren't seeing our patients in a timely fashion. And it's very important to see our patients and continue their well checkups, especially younger babies under the age of 2, because their growth and development and milestones are so important at this time. And there are a lot of things that we check for in the office to make sure that you're developing correctly and make sure that your speech is developing, that the children are using their fine motor and gross motor skills, they're developing correctly. So these are all things that we do check when you come into the office. And but more importantly, the vaccination schedule we try to keep maintained throughout the pediatric visits. So all of the checkups when you come in, one of the first few things that we go over is if you're on time with your vaccines, or is there anything that you're missing or anything else that you need. We go over that with you. So, oh, Mr. Ryder, I see that you joined. Thank you for joining us. So I just wanted to give you a quick overview regarding what types of vaccinations that we recommend at what particular intervals, why that is, why is there a schedule that we kind of follow and recommend, and how that works best for you and your child. So one of the things that I do like to talk to my patients about is because people do ask me, well, why are vaccinations so important? Why should we immunize our child? Why should we give shots to our child when they're so young? So having trained in the city, I trained at NYU Bellevue from 1996 to 1999. So after you finish medical school, you have to do a training period in the specialty or field that you are interested in. So I was always interested in pediatrics. And so I knew I wanted to be a pediatrician. And for that, you have to go through a little bit of training called residency, where you're basically getting your training in a hospital setting. So during that time, when I was in the hospital working, one of the main reasons that we would have admissions of babies under the age of 3 was something called pneumococcal bacteria. So this is a bacteria that is found out and about, and but babies under the age of 3 were particularly susceptible to this particular bacteria. They would get pneumonias and blood infections called occult bacteremia. So if a baby would present with a fever in the emergency room and we didn't know what was causing the fever, we would start with some blood tests and urine tests to rule out some of the organisms that it could be. And a large amount of those organisms, or a large amount of patients, would be seen with this particular pneumococcal bacteria. And some of the babies that we would see would have quite such a severe infection or severe pneumonia or blood infection, they would require IV antibiotics in the hospital for 3 to 5 days, and then be discharged home on oral antibiotics. So this was quite a severe infection that we would be seeing. When I was almost done with residency, that's when the Prevnar vaccine was finally approved for distribution. And it was around that time. I think it was in probably 96, 97 time. But by the time I finished residency and started private practice, we were using the pneumococcal vaccination. And it's given at 2 months, 4 months, and 6 months. And then we give a booster dose between 12 and 15 months. And because of that vaccination, we do not see pneumococcal bacteremia as much as we did in the late 90s. And that is the reason is because of this vaccine, we were able to protect the infants and young children from this particular type of bacteria. And we were able to, we have reduced admissions and hospitalizations due to this bacteria. Is it 100%? No, but we have not seen pneumococcal bacteremia in many, many years. There are sporadic cases sometimes, but that is one thing that I have seen personally in my own life that the vaccination has been helpful for. So some of the other vaccinations that we recommend are for the whooping cough. So the whooping cough vaccine is also very important to stay on the schedule and get at appropriate times, because it does cause severe symptoms in extremely young infants and the elderly. So most people, if they were to get, if they were to have a whooping cough or pertussis, it's called infection, they could recover if you were of good immune health and robust and healthy. So most people can get pertussis and do fine with it. I mean, it is called the 90-day cough. So it is something that you cough a lot and a long time with, but it is something that you will recover from. But if you're an extremely young infant or in the elderly category, then you may, it can be very dangerous, and it can be even fatal. So that is why at the 2-month mark, when we first start giving the vaccinations, we do recommend for you to get that DTaP, which is the Pertussis vaccine. Actually, currently we're recommending all pregnant women to obtain the vaccine, so that when their baby's born, they're protected already from the pertussis in that first 2 months of life. So it does protect the infant and the mom And then anyone else that's going to be taking care of the young infant should be protected against pertussis so that they're not accidentally transmitting it to the baby. So it is important to stay on the schedule of vaccines. Another important vaccine that I like to talk about is the measles, mumps, and rubella vaccine. So as you may be aware, the measles in New York, we had one of the highest incidences of measles cases in New York State in the year 2018 and 2019. And it was because there was a slight drop in vaccination rates in small areas. But because of that slight drop, we did start seeing actual measles. Measles is something that can be very dangerous. Can you fight it off and recover? Yes, but it can be very severe in some instances. It can cause something called an encephalopathy, which means it's an infection in the brain area. There's also measles pneumonia that can occur, and this can be very dangerous. So these are, and it's a virus, so it can lay dormant. You can get the infection, recover, resolve, and many, many years later, it can cause certain things later on. So it is important to get a measles vaccination and stay up to date with it and not have pockets of areas that have decreased immunizations. So when pediatricians and family practitioners and primary care doctors heard that because of the pandemic, there has been a decrease in the amount of visits and the amount of vaccinations that are being given, measles was one of the first things that we started thinking about, like, oh my gosh, if we have reduction in the amount of measles vaccination or in decrease in the rates, then we may get a resurgence or a return of vaccine preventable illnesses. And during COVID-19 and the coronavirus, the last thing we want is a return of diseases that are vaccine preventable. Because it's already tough enough to manage and help people from a virus that we don't have a vaccine for. We really don't need to have an increase in rates of diseases that we do have vaccines for. So, oh, hi, Robin, how are you? I see that you joined also. So, and just to kind of continue along that track is there are many other vaccinations that we give as your child gets older. So the vaccines that we give under 2 are a specific number of vaccines, but we repeat the same one so that their immunity builds on itself. So essentially, the vaccines that we're giving at 2 months, we give again at 4 months, and we give again at 6 months, because your immune system is strong enough to hold on to the vaccine or build the antibodies necessary, but at 2 months, your immune system is doesn't have strong memory. So when we give the vaccinations at 2 months and your body builds up the antibodies, and then they slowly start decreasing, and then at 4 months, they're not to the point where they're completely absent, but they're a little higher than what they were at 2 months. And then when we give the vaccine again, we remind the immune system of the same types of antigens, and it builds up another response even higher than the first one. And then that slowly starts to come down, where at 6 months, we give that final 3rd dose, and that really brings up the level all the way. And that's really the 3rd and final dose that we give for most of the vaccines. And then we do give a booster dose after age 1, because that's when your immune system is really can develop long-term immunity and good memory cells. So it really is important to kind of maintain that kind of schedule so you get the optimal amount of immunity. So, and then there are other boosters that we give during school age or prior to starting school. So the pre-K and kindergarten visits are also very important, where we continue to give the, again, the pertussis boosters given at that time, measles, mumps, and rubella. We give a chickenpox vaccine. And so these are all important booster dosing of these vaccinations that are given at these kind of intervals. And the intervals are very well studied. The way that we recommend the vaccinations and the way that we recommend the timing of them are very well studied to give optimal immune response and give your body a really strong and ability to fight off the illness. So let me see, I'm just going to look at some of the questions. If you guys have any questions, please let me know. But essentially, some of the questions that I got is, well, why is it so important that I vaccinate my child? And that was from one of the people that work at the Elwood Library. And it is so important because some of these illnesses, if you do get, well, hopefully you never get naturally, because there are groups of people that have now been immunized against, let's say, polio. So that's a good example. So we really don't see polio anymore, right? There are certain areas in other areas of the world that still have polio because unfortunately the vaccination rates are very low, or they don't have access to the vaccination. So we do see polio in other parts of the country, in other parts of the world. It is important to continue to vaccinate so we don't see a resurgence of something like polio, which has almost been wiped out. I believe in 2000 we almost had wiped it out, and there are certain resurgences in some areas, but not in the U.S. And it's important to continue that so that we don't see a recurrence of some of these illnesses that can be very dangerous. Has there been any evidence that vaccinations cause autism? So this is a very, very common question that I get in my office, and most pediatricians do get. And what I want to say first is talk to your pediatrician, talk to your doctor, because we do want to work with you. Just to answer that question, there was a study out from England around in the time, I guess, that I was doing residency, so probably around the late 90s. And they did find that there was an association between the measles, mumps, and rubella vaccine and autism. However, since then, we have learned that there is no association, and that study was not very well founded. Unfortunately, years and years have been spent on trying to figure out if there was an association of measles, mumps, and rubella with autism. And we do know now that there is no association between those two things. But is there a rise in the rate of autism or autism spectrum? Yes. Do we know why? No. We are trying to figure out why there is an increase in the incidence. And there are many, many theories, but I think what's happened here is that there was so much kind of data and studies focused on trying to figure out whether measles, mumps, and rubella was what may have been increasing in the causality. So unfortunately, we still don't know exactly why there are increase in these incidents and diagnoses. We are working on whether there could be a genetic predisposition and perhaps an environmental turn on, but there's many, many theories at this point. The most important thing, though, is we do know that if we do pick up some of these issues early, for example, speech delay or poor eye contact, or not recognizing or not smiling as much in the early newborn period, which is another reason why we want you to come visit the pediatrician as often as possible, and especially those early stages. The earlier that is recognized, the better, and if we give early intervention or earlier access to intervention, the better outcome for the child. So I am a big believer of early intervention, access to early care, access to if a parent feels that there is a slight delay or a slight issue, or even if the parent doesn't realize and I pick it up, I'm a very big proponent of early intervention. So I know I sidetracked a little bit to discussing delays, but that's another reason why it's so important to continue to visit your pediatrician and make sure that you have multiple visits, so we can kind of compare and make sure that we see the growth and development at an appropriate rate. And if we do find that there is a slight delay, that we target early, and that's really key. So going back to the question of, does the vaccines cause autism, that's a resounding no. But if you're still concerned, or you're concerned about some of the things out there that vaccines could be associated with, talk to your pediatrician, because I can't emphasize that enough. We are here for you. We want to encourage you to talk to us. If you are concerned about something specific, we can talk to you about it. We're on a team. I try to tell my patients at work that we're a team. We want to work with you and give your child the healthiest environment to grow and flourish. So, oh, hi, Anthony. How are you? Let's see. So another question that came in about the coronavirus. So if they came up with a vaccine for coronavirus, would you vaccinate your children right away? And then there's another question, would you get the corona vaccine yourself? So as you know, vaccines take many years to develop. The vaccine for HPV, for example, that's the newest vaccine that we've been kind of advocating for or recommending. It's not something that's required, but it's recommended. That was studied for almost 10 years. It was released after 5 to 7 years of study. But even after that, the data has continued to be very good. And we recently just finished, I believe, tracking as far as like 15 to 18 years of data. So vaccinations get studied for a long time before they're released, especially for children. And going back to a coronavirus type vaccine, there's a couple of things. So one, we have to make sure that it is safe to give to adults. And in the beginning, when if there is I understand that they are going through, they have reached human trials, but even those have to be kind of really tracked and closely watched to make sure that there's no effects that we don't know about. And when they do release it to the public, it will be on a voluntary basis, and it will be to people that perhaps healthcare workers or first responders, or people that are exposed more, people that are in the hospital, in the ICU type setting, or in the ER, will probably get offered the vaccination before the general public. And it's a way to study the vaccine, and also it's a way to release it a little bit wider. As far as children and the COVID vaccine, it would be very, it needs to be, the data needs to be there for many years before things are approved for children, especially. And there needs to be more data regarding the antibody production in children. We do know that the multi-inflammatory systemic inflammatory process in children that has come up recently with relation to the in relation to the coronavirus in some children, it is very rare, and it's an inflammatory response to your body's production of antibodies. So essentially, it didn't happen. We didn't see these children present right away when we were hitting our peak, which was end of March, beginning of April. We saw it 4 to 6 weeks afterwards, and that's when our local hospitals, Northwell, Winthrop Hospital, Huntington started, and some hospitals in Manhattan started seeing an uptick in this kind of very inflammatory, severe response to the COVID antibodies. So they would test these children that would present with high fever. So the symptoms are high fever, low blood pressure, rash, red eyes, vomiting, and belly pain. And it's quite severe. It's not something that's subtle. It is a quite severe presentation. But let me make sure that you're aware that it's extremely rare. So this is a very rare effect, but it is associated with the antibody production. So it's not that directly from the virus itself, but your antibodies that have built up. So this is going to play a role in how we think about the vaccine in children. It is going to have to be studied a lot more before they release it into the pediatric population. So it's going to take time. That's going to take time. Let's see. And how many years would it take before a vaccine has been on the market to really know its effectiveness, side effects, and or long-term side effects? So this is a very good question. Unfortunately, it does take many, many years to truly know the long-term effects. But we do know the way vaccines work, and some of the vaccines, for example, the HPV vaccine, human papilloma vaccine, is modeled after the hepatitis B vaccine. The hepatitis B vaccine has been around for close to, I believe, 30 to 40 years, if not longer. And it's been a very safe and effective vaccine. It's also, hepatitis B is also a virus that can cause, later on, can cause cancer in your liver. So the hepatitis B vaccine is something that we find reduces that likelihood of the hepatitis B virus converting into liver cancer. So the HPV vaccine is modeled after that vaccine. And so we know the safety studies and the safety numbers for the hepatitis B vaccine. HPV has not been around for as long, but it does prevent certain types of cancers, and it has been shown to be effective in certain populations. So I think it is we do recommend it. It is not something that's required, and but it is something that's strongly recommended. Another vaccine I forgot to mention for college age and even high school adolescents is meningitis. So the meningitis vaccine, and even the pneumococcal bacteria vaccine, the pneumococcal bacteria that I was speaking about earlier, does cause certain types of meningitis as well. And with the advent of Prevnar vaccine, we have seen a reduction in meningitis associated with the pneumococcal bacteria as well. But meningococcal meningitis is something that is very rare. Again, it's very rare, but it has severe symptoms and can be fatal. So it is a vaccination that we strongly recommend. It is required for most. It's required for college. It is required in the high school time. There are 2 doses that we give, one at age 12 and one at age 16. And it has shown reduction in meningococcal meningitis. This is a severe bacteria that can cause inflammation of the fluid around your spinal cord. So we have our nerves, the spinal cord, surrounded by fluid called your meninges. And certain bacteria and virus can cause inflammation in that fluid, causing severe headache, vomiting, and a stiff neck, so with fever. So this is always, whenever you have a baby or a young child presenting with high fever and vomiting, we always check the neck, and we always ask about vomiting or or lethargy, which is when they're extremely tired or not responsive, because that is something that can be very dangerous and very rapid onset of illness, and something that requires hospitalization and care right away. And there seems to have been 2 spikes in when we would see meningitis in children. So the early onset of puberty, so around the age 11, 12, 13, and then there was another spike that we started seeing around 16 to 18, and that's when the meningitis booster dose started to be given about five years ago. Prior to that, we were just giving the 1 dose at age 11 or 12. But since then, we've required 2 doses, because even the kids that got that 1 dose between 11 and 12 needed to have a booster dose. As I said before, in the babies under 6 months, they require repeated doses of the same vaccine. So this is the same principle, where you're giving the same vaccine at age 12 and you're giving the same vaccine at age 16 to really make that immunity more permanent and stronger, so that they can really fight it off if they were exposed to it. So the reason why it's so important for our college age students to get the meningitis vaccine is because we do see a spike in incidence in that age group, the 16 to 18 age group. And because they are in close quarters during, on college campuses and in classrooms and, in the dorms, there is more time and more there is more of a exposure that can happen, and that's why it's so important to protect yourselves from from meningitis and get the vaccinations on time. So these are just some of the main points that I wanted to cover, and I hope that it's been helpful for you to discuss some of these vaccinations. But I guess the main issue that I really wanted to make sure that I voice and that I let you know is to really communicate with your primary care doctor. They're there to make sure that you stay healthy. We're experts in preventative care, so we want to make sure that we do everything we can to prevent anything from happening to you. Now, it's not, of course, 100%, but it is better to find out if you have high blood pressure or any issues in your body earlier than later. Just like with early intervention with the small children, it is known that if you find out if there's a speech delay or if there's a delay in motor skills or delay in fine motor skills, and it's more important to find out early, and there's less of a gap that you can close and improve long-term outcome. So same thing with your regular care, and that's why when you go to see your doctor, your blood pressure is checked, your heart rate is checked. We make sure that we kind of go through everything and make sure that we target the main issues for that age group and try to provide the best care that we can. So continue to see your doctors. Even during this time, we are trying our best to keep you safe. We are trying to make the office space as least exposure, with the least exposure possible. So, for example, in my office, we ask you to call and make the appointment for your well check with your child. And we have you call the front desk when you arrive in the parking lot, and we don't have you come in until we have a room ready for you. When you enter the building, all patients and adults and everybody's temperatures are checked upon entrance into the building, and you go into the department that you, for example, pediatrics. You come into the pediatric department and you're taken straight into the exam room. The exam room is has always been cleaned, but now it's really thoroughly cleaned and disinfected. And all of us are wearing our not only masks, and everybody's given a mask upon entrance into the building, but not only are we wearing masks and gloves, we are wearing face shields, and that is to protect you and to protect us. And we do this so that you can continue to come in and for your appointments and for your well checks. So I think if anybody, oh, Lisa joined, and hi Maureen. Hi. I hope you guys are getting something out of it. It looks like we don't have a lot of people, but if you have any questions or any concerns or comments, I'd be happy to answer them. Immunizations, vaccinations are a very important subject for me, for any pediatrician, anybody in primary care. And I know that there are concerns about vaccinations, and I know that many parents do have concerns about vaccinating their child. I think the best thing is always to communicate with your pediatrician and always talk to them. Let us know what you're worried about. Let us know what your concerns are, so we can address them and we can help you. If we don't know the information that you're looking for, we can find out for you. But these are the vaccination schedule, and the schedule that we recommend is well studied. It's through the American Academy of Pediatrics and the CDC and the American Academy of Family Practice Physicians, and it's a well thought out and well studied recommendation, and it's really to keep everyone as healthy as possible. So I know that we started a little bit late, but if there are no more questions or you know, anybody has any concerns, again, it's really important that you always speak to your pediatrician. My advice is a general type of advice. It's important that you don't take this as your as strict advice to your own child, because your pediatrician knows exactly what's going on with your child and can help you the best way possible, and can discuss with you individual concerns that you may have. So, all right, I think I'm gonna end it here. I hope everybody has a great night, and I hope everybody gets to enjoy some of this beautiful weather that we're having. And I hope everybody stays safe and stays healthy. And if even one person calls their pediatrician and just kind of asks about what they're due for or when their next checkup is, I think that you know, that's a good thing, to maintain contact with your not only your pediatrician but your primary care doctor. And that happens a lot too. I do feel that a lot of people ask me questions about their own personal health. I mean, they ask me questions about their children, obviously, because I'm their doctor, but they also ask me questions about what they need. And sometimes we recommend, obviously I can't care for adults, but I do recommend certain things, and often I'm their first point of contact, so I try to make sure that the parents also get the care they need, because you do have to fill your own cup before you can pour for others. So it's really important that you take care of your health, and then you can take care of your children's health as well. So, all right. I hope this was helpful. I'm going to wish everybody a great night. Thank you for joining, and thank you.